population of seniors in Toronto and Central Ontario. A larger, modern hospital will allow all individuals, families, seniors, and thousands who move into North York each year to access the very best care close to home throughout their lives. One of North York General's strategic directions is people come first in everything we do. This is something we believe in deeply, from our staff and physicians through to our volunteers and students. Despite our extraordinary challenges over these past few years, our team continued to provide our community with the highest standard of care. We are proud to have been named the leading academic community hospital in Canada by Newsweek magazine for the 4th year in a row, and among Canada's top employers by Forbes magazine earlier this year. Having a leading-edge building designed for healing, advanced care and safety is essential to people-centered care. And our new patient care tower will also be the anchor for North York General Hospital's campus of care that will include a new expanded long-term care home soon to be built, our new reactivation care center, and our 4 other community sites. I would like to thank Minister Elliott and the Ontario government for their commitment to modernizing healthcare in Ontario, and our MPPs for being strong champions in our community. Thank you to our community, our Ontario Health Team partners, and our donors for their unwavering support for North York General Hospital. It is now my pleasure to ask the Honourable Christine Elliott, Minister of Health, to provide remarks. Thank you.
Well, thank you very much, Karen, for your very kind introduction, and good afternoon, everyone. Thank goodness the weather turned out for an outdoor announcement for today. But it is wonderful to be here today alongside my colleagues, Minister Cho and MPP Cook. Thank you very much to the team at North York General for welcoming us here today. And thank you for everything that you do to provide exceptional care to your patients, especially during these unprecedented times. I also want to extend our deepest thanks to Ontario's healthcare workers for their extraordinary dedication and efforts during this time. Time and time again, our healthcare providers have gone above and beyond to keep our communities healthy and safe. Providing care to Ontarians throughout the pandemic was no small task, as we all know, but working together, you quickly mobilized to face COVID-19. Now, our government has made historic investments to protect communities and to strengthen our healthcare system. This includes $5.1 billion invested in hospitals since the start of the pandemic, and adding over 3,100 extra beds, including 46 beds here at North York General. Over 23 million PCR tests have been completed, and over 135 million rapid antigen tests have been distributed both to businesses as well as to the general public. And Team Ontario has administered over 32 million doses of the COVID-19 vaccine, with over 86% of eligible Ontarians now fully vaccinated. All of that hard work has led us to the place where we are now. We're a place where our province can safely manage COVID-19 for the long term. Our government continues to move forward with building a stronger, more resilient healthcare system that Ontarians can rely on now and well into the future, and one that is better prepared to respond to any crisis. And as part of our government's plan, I am very pleased to advise that today Ontario is investing an additional $3 million for the modernization and expansion of North York General Hospital. This is good news, thank you. This funding builds on a previous investment of $2.5 million for a total of $5.5 million that will be used to plan the hospital's redevelopment, which will improve access to care for patients and families both in North York as well as in the Greater Toronto area. The redeveloped hospital is planned to include a new inpatient care tower with new and expanded operating rooms, a new emergency department, and over 100 new inpatient beds, which would bring the total number of beds at the hospital to over 500, in keeping with a growing population. In addition, renovations to the existing building will expand key services, including medical device processing, as well as laboratory and pharmacy services. To further support high-quality care in the Greater Toronto region, the Ontario government is increasing North York General Hospital's operating funding for the third straight year. Starting in the 2021 fiscal year, the hospital will receive over $8.3 million in additional operating funding, which is a 3% increase to the operating funding the hospital received in 2020-2021. North York General also received over $2.4 million for lost revenue during 2020-2021 as part of our government's investment of more than $1.2 billion to help hospitals recover from financial pressures created and worsened by COVID-19. From day one, our government made a commitment to end hallway healthcare and to build a better, connected healthcare system which is focused on the needs of patients. Our government's continued significant investments in healthcare are helping to ensure that Ontario's incredible healthcare workers can have the resources they need to continue providing world-class care. And by investing in the expansion and redevelopment of North York General, we are continuing to deliver on our government's commitment and, most notably, enabling the hospital to better meet the needs of the communities that they serve. So thank you. And now I would like to invite the Associate Minister of Transportation and MPP for Willowdale, Stan Cho, to please say a few words.
Well, good afternoon, everybody, and thank you, Minister Elliott, for that kind introduction. It's always a pleasure to be back here at my home hospital of North York General. Let me rephrase that, actually. It's always a pleasure to be back here at North York General when I'm not feeling sick. But this is a hospital I've been coming to since the 80s. I grew up just down the street on Leslie Street. And you know, Karen really underscored the change that North York General has seen throughout those decades. The capacity was staggering. I mean, the increases to the use of North York General really highlight the need to invest into our healthcare system, to invest into North York General. You know, my community has seen unprecedented growth. In fact, we have hit our provincial growth targets for population for 2041, and we did that 4 years ago. That makes it almost a quarter century ahead of projected population growth schedules. And that growth is continuing. And of course, we have a very diverse population, but we also have an aging population, which is why today's announcement and some of the investments Minister Elliott outlined are so crucial to the future success of our healthcare system overall, but indeed here at North York General. You know, when our government took office in 2018, we not only made a commitment to ending hallway healthcare, but we made a commitment to better health the future and understand the growing needs of our healthcare system and the importance of creating that whole patient-focused, centered care for patients, not just today, but for generations to come. And despite the difficulties in the last 2 years of COVID-19, I think that this has really put our focus in government more centrally on the importance of investing into that very healthcare system. And so today's announcement is the next step. Of course, there is more to be done. In fact, MPP Ke, who I will introduce in a moment, and I will be here tomorrow for another great announcement. So I'm hoping we can just camp out in the gazebo underneath a little bit later. But I am always proud to be back at North York General, and I thank our government and Minister Elliott for the amazing work that's gone on, and I look forward to more good news very soon. With that, I'd like to introduce the MPP for Don Valley North, Vincent Ke.
Thank you, my friends, Minister Cho. Thank you for your introduction. Good afternoon, everyone. Welcome to Don Valley North. It is my great pleasure to join you all, especially the Minister Elliott and Minister Cho, CEO Karen, and also Dr. Margaret, to celebrate this additional funding announcement for the hospital's Inpatient Redevelopment Project. The pandemic has shown us that we are resilient and reliable and flexible and determined to prioritize healthcare in our province so that in the future we will be prepared for any crisis. This important investment is a significant sign that the government is making progress in its quest and commitment to improve and protect the healthcare system to support patients and those who care for them with compassion and competence, and prepare the hospital to greet the challenges that lie ahead to end poor healthcare as we promised. As the North York General Hospital continues to build upon its strong foundations with plan to add new patients' beds, build a new emergency department, and expand operating room space, it will be better equipped to accommodate over 118,000 visits to the hospital's emergency department every year, and the fastest growing population in the community of Don Valley North and beyond. Congratulations to everyone in North York General Hospital. Especially congratulations to the leadership team of the hospital. I know you have been working so hard for this project. Thank you. So now please join me to welcome Dr. Margaret to speak about how important this investment for the community and for the hospital. Thank you.
So good afternoon, everyone, and thank you, MPP Cook. It's a great pleasure to be part of this announcement today. In addition to my role as the Vice President of Medical and Academic Affairs, I'm a frontline healthcare provider. I'm a surgeon. I work in the ICU as an intensivist. And I can't tell you how grateful I am to have been able to practice my passion of medicine at North York General for over 20 years. I didn't start here, but I came here, and it was the best decision that I ever made, and I think I'm a lifer. I'm very excited to celebrate this announcement today because I know what a difference the Patient Care Tower will make to our patients, to our community, and to our healthcare teams. Like everything in healthcare, hospitals are about people. The people that come for care, the people that get life-saving treatments and procedures, the people that we care for at their most vulnerable time in their journey, sometimes end-of-life care, and the people that we nurture and navigate back to health and encourage them and support them to become vital and healthy members of their community once again. The state-of-the-art Patient Care Tower will allow us to look after patients with the best environments and the best infrastructure and equipment in a state-of-the-art way. COVID-19 taught us that buildings are important. Buildings can be facilitating of care, or they can sometimes be barriers to care. At North York General, we have an old infrastructure in an old building. And we have rooms that have 4 patients in them, and 3 patients, and 2 patients. And during the pandemic, we had to make those rooms single patient care rooms, because in order to provide the best care, we had to isolate patients and keep them safe. But those had downward repercussions, and that occurred in the sense of limiting sometimes access, bottlenecks, things backing up in the emergency department, but we had to do it for our patients. In the new patient care tower, 100% of the patient rooms will be private, and that's a huge, huge important thing that we can do in the future for our patients. So just to give you some examples of the different departments, our new enhanced labor and delivery unit will be all single rooms. And it's not just important for infectious disease reasons, but it's also important for our patients, their families, their privacy, their experience, and the intimate, important things that happen in a family when their new baby is born. North York General has one of the busiest emergency departments in the GTA, and our new patient care tower will add over 40,000 square feet of emergency room space to look after the ever increasingly complex and sometimes aged patients that come to our emergency room, including our acute mental health patients that need our support so vitally, especially now. The new tower will be the new standard for accessibility and for looking after aging adults. As a surgeon, I'm really thrilled to think that we're going to have at least 8 new operating rooms, which again will have the latest in technology and equipment to support our patients that need surgical procedures. So on behalf of the North York General Healthcare team, I'd like to thank Minister Elliott, the Ontario government, Minister Cho, and MPP Ke, as well as all of our community partners and our foundation for providing such great support now, in the past, now, and I'm sure in the future, to help make this new tower a vital and important structure moving forward. Thank you. And I'll ask Karen to come back to the podium.
Thank you very much, Dr. McRitchie. This now brings our event to a close. Thank you again for joining us here today. I would now like to call the Minister's Press Secretary, Alexandra Hilkuni, to facilitate question and answer.
We'll now take questions from the media. If you have a question, please line up behind me at the mic. And just a reminder, it's one question, one follow-up. Thank you.
Hi, I'm here. I'm Andréane Williams with Radio Canada. My question is about the 6th wave of COVID. Ontario is now in the 6th wave, and hospitalizations are increasing. So how is the government planning on tackling the 6th wave with relatively no restrictions and measures in place, and not even the mask in public places?
Well, we knew that the numbers of COVID patients were going to go up as we opened up Ontario and released some of our public health measures. So there's really no surprise here. Dr. Moore has said this on several occasions. But what we have now that we didn't have before is a highly populated, vaccinated population, We also have the antivirals, and there are other tools that we have that we didn't have before. We also have the capability in both of our hospital and med-surg beds as well as in ICUs to handle any increases. So we will get through this, but again, it's not unexpected. We anticipated that this would happen and we're prepared for it.
One of the things that doctors we talked to told us is that the more cases there are in the population, the more at risk people working in the hospitals are to get COVID, and that can create shortages of staff and beds being closed. So how does the province plan on tackling this issue, and do you have any concrete information about what's going on in the hospitals at this point?
Well, first and foremost, we want to make sure that everyone is a health professional that is helping patients with COVID and with any other problem that may put them into a hospital. We want to make sure that they are safe and well protected. So we do have stringent infection prevention controls. And as well, we have the tests that people can continue to take. We have millions of the rapid antigen tests now that are available. So people can test themselves frequently to make sure that they're safe and that the people that they will be caring for will be safe as well.
Hi, Nusheen Ziafati, Canadian Press. My questions are also for you, Minister Elliott. Is there a number of hospitalizations or ICU admissions at which the government will bring back some measures like masks or hold off on lifting other restrictions at the end of April?
Well, we're going to continue to take a cautious approach as we keep advancing the opening of Ontario, and of course we rely on the advice and recommendations of our Chief Medical Officer of Health, Dr. Moore, and his advisors. And so at this point it doesn't appear necessary that we need to take any further precautions, but we'll continue to follow it, and as Dr. Moore gives us advice, we'll certainly be ready to take it.
Is the possibility of public restrictions being reintroduced off the table entirely?
One can never say anything entirely at this point, but what I would say is that we're following it very closely. Dr. Moore and his team are following things closely. We have the capability in our hospitals now. We have a highly vaccinated population, and we do have the antivirals, which we're receiving more and more of. So we are following it carefully. If we need to take any further measures, we will. But so far it doesn't appear that we need to do that.
Hi there, Gordon Dick from Global News. I'm asking questions for Matt Bigley. The first question is as mentioned earlier, we're now in the 6th wave, and Dr. Moore is no longer giving regular updates to the public. Why, at a time when public awareness could help keep cases down, is the top doctor not out providing up-to-date information and guidance?
Well, I would say because this was not unexpected that we would see the numbers continue to go up, but we do have the capability in our hospitals to manage any increases, and Dr. Moore is of the view that at this point we are able to now learn to live with some continued cases of COVID. Unfortunately, it's not going away completely just yet, but we need to move on and continue with first of all, the opening of our economy, but also so that people can get back to a more normal way of life.